Hi everybody, good morning. I'm Dr. Lin. Today my recording, by the way, it's been almost 3 years since I did any recording. Well, not counting the last one, which is last year. That's just a test run. But I'm going to start weekly giving you, the audience, a lot of knowledge and information about overall health. So let me introduce myself. I'm Dr. James Lin. Today, primarily, I'm going to talk to you about what I become, the pain doctor that I am. And not just the pain doctor, I'm doing a lot of nutritional therapy as well. I'm doing a lot of energetic therapy. I study acupuncture. I'm doing a lot of acupuncture with my hand, with my finger, pointing therapy. And on top of that, I do a lot of chiropractic adjustment with machines. And I'll show you eventually during the videos, the ongoing videos, I will be showing all the different equipment that we use to help different various type of conditions. Okay, it's very exciting. I feel very excited that I can tell you all this information. Okay, so let me just tell you why I become a chiropractor, a pain management doctor, a nutritional, the whole health nutritional guy. Why? Because it all starts with my son, actually, because he was so sick. And when he was born, his entire body is filled with eczema. And that time, I didn't know what to do. And then on top of that, he has fever like every single few weeks. And we have to take him to emergency like almost once a month. And you know how emergency is. You stay there all night. You have to wait for 3, 4, 5 hours. And then you see a doctor for 5-10 minutes and you're gone. And all he gets it's child some kind of anti, how do you say this, antibiotics. And it doesn't really help. I mean, it does help when he gets back home. He take a few days, he's better. But he's just ongoing fever, ongoing sickness and flu. And on top of that, he has all the skin issue that he itches every single night. We call it eczema. I have to carry him all night, almost every day. My wife and I, we take turns. It was just the hardest time of our life for me and for my son as well. So because of that, I keep searching for different solution, to help my son and myself so I can get more rest. So I found one of my doctor friend, Pei Vaughn. He studied this special technique called nutritional response technique. And I'll explain that to you later on episode. I'll demonstrate for you. And after he did that nutritional assessment technique, response technique, my son, I see dramatic changes. And after that, he no longer have to go to the emergency. And his skin, and of course, when my son started to get better, he's not getting sick anymore. And also he helped me with my neck at that time. I have a lot of physical issue myself, being a chiropractor. And, a lot of chiropractors out there have a lot of physical issue. Anyway, so use that technique, nutritional response technique, through supplementation, through diet control. My health is completely changed. My son's health is completely changed. My son no longer have to go to the emergency. And he's from that time till now, it's been almost, 12 years. He has not gone to the hospital or clinic. Because after seeing such dramatic changes, I started learning the technique. And that is the very first, how do you say this? Specialized energetic technique using supplementation that I've learned And after that, I've been using on patient, and I see dramatic, results. It used to be I can get, how do you say it, maybe 3 or 5 out of 10 people that come to me, I could get them better. But after that technique, I can get about 7, maybe 6 or 7. I mean, that's a big change for me. 6 or 7 out of 10 patients start seeing really good results. Okay. And that's why that's why I do what I do now. I don't do just chiropractic. I mean, I do very little chiropractic adjustments. Hands and machines and correcting bones and cracking pops. I do very little of that because I see that a lot of pain, joint pain, back pain, neck pain, whatever pain you call it, the pain just does not come from the physical condition. It comes from internal, psychological, physiological. It comes from internal organs. It comes from the function of our body. That's why in order to treat pain, we cannot just, do physical therapy. We cannot just do cracking the spine. We cannot just train the muscle. It just doesn't work for a lot of patients. We gotta do something else. And that something else is, the nutrition part of our practice. Okay, so I think it's good for now. I will talk more and more in the later on episodes. So please stay tuned. Make sure to subscribe to my channel and push the like button so that I know that you guys are watching out there, so I can give out more and more information to you guys. Alrighty, see you next time.